This is State Representative Tom Morrison. Thanks again for joining us on this live broadcast. I am pleased to be joined once again by Dr. Sue Nelson. So thanks again for joining me. And it was a very, very extensive press conference today by the governor. And it sounds like the stay-in-place order is going to be extended for another month, although there might be some adjustments made to that in terms of what might be non-essential medical procedures, things like that. So I think details on that are going to emerge. Obviously, that's going to affect the hospital, and that's going to affect just other medical providers, dentists, and what have you. But did you have a chance to see the press conference? Did you have any thoughts on that?
I didn't get to see the press conference myself. I'll try to listen a bit later. I did hear, though, that he did mention giving a green light to some of the elective procedures, and as a healthcare organization, we've been preparing to respond when state or local officials have given kind of the go-ahead to start easing up on some of those restrictions.
Okay. And you'll probably notice in some of the questions that we got that has been a question that a few residents have asked, is that they had, whether it was a heart condition or some other surgery that had been scheduled. I had talked to you last week about a constituent with some kidney issues. How is that going to affect our community along those lines?
So I think as it relates to questions regarding if people have had a procedure or a surgery that's been deferred or delayed, what can they expect to happen, or any type of procedure? I think from our perspective, what we're looking at is the patients who've had procedures or surgeries deferred, and trying to prioritize of those deferred procedures which need to kind of pop up to the top of the list. And that might be things relating to the criticality of the illness or the underlying condition, heart conditions, cancer-related conditions, is one way to look at it and risk stratify that. Another is to look at procedures in terms of the relative risk to patient and or staff. Again, as we see the easing of the stay-at-home order or of the elective surgery order, we're looking at making sure that first we stay aligned with state and local government recommendations and guidance about what we're doing next. The second is being sure that we have adequate PPE supplies to be able to do those types of procedures or surgeries safely, both for the patient and for our staff. And then the third is that prioritization based on the type of surgery or the complexity of the underlying illnesses.
So once again, we're live with Dr. Sue Nelson. She is the Vice President of Physician Operations at Northwest Community Hospital. So go ahead and ask your question in the comments below. I'm going to get started with some of the questions that were pre-submitted, if that's all right. After our talk last time, we had a constituent asked about the differences between if they came down with COVID, or at least they had the symptoms, whether they got testing or not. What were some of the recommendations you provided to deal with some of those symptoms? And one question had to do with Tylenol versus Advil.
So a good question. I think that this is something that continues to be a concern for patients if they do develop symptoms. One reminder is that the majority of people who do come down with COVID have minor illnesses that can be managed very well at home. And what we recommend, again, primarily based on the availability of testing material, we don't recommend testing for people who have mild symptoms. We recommend self-management at home. So if I was talking to a patient who had symptoms that could be suspicious for COVID, we would recommend that they go home, they self-isolate, they try to remain separated from the other members in their household as much as possible. Separate bathroom, using separate utensils, wiping down surfaces, all in an effort to try to reduce the spread within a household. For treatment of symptoms, acetaminophen or Tylenol is recommended for some of the fever and muscle aches. There had been concerns earlier on about ibuprofen. I think that's what your constituent was asking, whether or not they should avoid ibuprofen. There's no evidence that it causes harm in any way, the ibuprofen. I think that the original recommendation was acetaminophen as studies continue to take place, we'll learn more about ongoing recommendations. But acetaminophen or Tylenol for fever is recommended, and then fluids. I think there was a question from one of your constituents about cough medicine or cold medicine. For viral type of illnesses, again, there's no specific treatment for the common cold, just like we don't have any treatment for COVID. It's all related to symptoms. So if you have a cough, you can take a cough medicine or cough syrup or Robitussin type of cough medicine to soothe that. Fluids, rest, trying to eat healthy. If just healthy food, just in terms of overall wellness. But those are the types of things that we recommend, is just managing for symptoms.
Okay. If you're just tuning in now, we're with Dr. Sue Nelson. She's at Northwest Community Hospital. She's going to give us an update. I've got some really good graphs on the, and Susan just asked a question about that. I've got some really good graphs that I got from the Cook County Public Health Department, and we're going to share those. Also, we could talk about capacity at Northwest Community Hospital. You've been wonderful in giving us these very timely updates, because again, this is this is a topic that our residents have been really concerned about. As we've been staying at home, doing the social distancing, now starting to wear face coverings and doing those things, we've been told we need to flatten the curve so that we don't overburden the healthcare system. And our residents have been really interested to know those current numbers. So we're going to get into that in just a second. I'm putting up right now the Cook County Public Health confirmed cases map. So that just kind of shows you for the Northwest Community Hospital area where we sit. What are the current numbers of positive cases actually admitted at Northwest Community Hospital?
As of this morning, so these stats are constantly changing or dynamic, but we had 39 positive patients in the hospital with COVID, and an additional 20 that we referred to as that PUI, people under investigation. 19 patients were in our intensive care unit. We have an availability of 66 intensive care beds, with a plan to expand that if we do start to see surge capacity. Of those 19 patients that were in the intensive care unit, 16 were on ventilators. Of those 16, 10 of those were COVID patients. So we have a ventilator capacity of 72 ventilators. So again, in pretty good shape in terms of the capacity of the hospital and availability of resources.
As questions continue to come in, so I had another person ask about NCH's satellite facilities. Are those open, or what's the status of those if someone needed to have a needed routine care?
For patients that do need to be cared for, both for COVID and for non-COVID related illnesses. And so all of our primary care and specialty care offices have remained open, including our immediate care centers. What we would encourage patients to do is call first. Call your primary care provider first. We have a process for a telephone triage and even a telehealth visit. So we are trying to convert as many in-person visits to virtual visits, telephone or video, to try to manage patients' care that way. That is as part of the flattening the curve strategy and helping maintain that social distancing. It decreases the patient's potential exposure to other patients, and it helps in terms of protection of staff as well. So those facilities are open. If you call, we will go through a triage process about symptoms. We have also created within our organization a special location that is specifically designated for COVID patients, either COVID positive patients or COVID suspected patients. And by doing that, that facility, and in which all of the providers and staff are geared up with their appropriate PPE, we have a process for patients to be triaged and brought in to be evaluated. And that way people who do have COVID type symptoms can be appropriately managed and evaluated in person if need be. But it diminishes the tendency for those patients who have symptoms to come into another office where there might be some exposure to other patients or staff.
All right, and then we've also gotten a number of questions about just the transmission of COVID-19 again, and we've pointed people to the CDC's website. So if you're looking for the most up-to-date information about that, You can find that at cdc.gov, unless there's anything else you want to add, Dr. Nelson, on that.
No, that's an excellent resource. That cdc.gov website also has information about how the virus is spread, which we know is respiratory droplet. That's why all the precautions in place about social distancing or wearing a mask make a significant difference in both the risk you have to others and others toward you. The other thing that is on the CDC website is a symptom tracker. So if you have concerns about symptoms that you have, you can go on and kind of go through a checklist, and it'll give you an idea of whether that's something that would be reason to contact your healthcare provider or reassure you.
Okay. Let's talk about. Oh, okay. So so people are asking again about what is the rate of incidence of confirmed cases in Cook County in our immediate area. Again, I could point you to the Cook County Public Health's website. Let me see if I can pull that up now. So this is just a few of the graphics here. You can look it up you can search by town. They also have it by age. And so I don't know if you can see this, Dr. Nelson, or not, but I'm showing this is what has been reported to the Cook County Public Health Department by age and then by sex, the rate per 100,000. And again, you can see the high end toward those of our elderly population. And so along those lines, we've had a question about testing. Rick wants to know, should testing be done at all? Should testing be done of the residents and staff at long-term care facilities and assisted living communities to help prevent the likelihood of the spread of the virus? Do you want to take that on?
Yeah, a couple questions within a question there. The graphics that you're showing with the distribution of age or location, I know that some of the constituents were asking about how do they find out about in their own, even more local communities. And the Cook County Public Health Department website does have it by town. The Illinois Department of Public Health has a similar on their website where you can narrow it down by town or zip code to get a sense of what's happening in a very regional, local community. The demographics related to age, we know that the senior population is more commonly affected in terms of severity of symptoms, and the website is showing you people who have been tested and been shown to be positive, which is going to be because there's not a very much community-based testing of low, mild symptoms. This really represents the people who predominantly have been hospitalized. And so we know that affects the elderly population to a greater degree. And so your graph does show that greater than 60-year-old patient population are the ones that we have see the most significant number. You see very few cases in that less than 20-year-old category, and that might be that they have minor symptoms. It doesn't mean that they don't have it at all. It just means that they may have minor symptoms and don't seek care. And because we're not testing everyone, we don't know that that's there.
Okay, and along those lines, Pat wanted to ask if you have any update on testing. What about testing for antibodies?
There is definitely within the last week, we're seeing more commercial firms and hospital systems making available immunoglobulin or antibody testing. I think that this is still in a very early phase where it is available. There's still some question that we're working on as more and more of the research is being done as to how to interpret the results. So the antibodies come back, we feel like that does demonstrate that the individual did have previous exposure, but we don't know enough yet to know whether that confirms immunity, or if it does, how long that confirms immunity. So we'll know more as it continues to develop. What is valuable in terms of the antibody testing is patients who may be interested in being donors for convalescent serum. If you test positive for the antibody, that is one of the criteria to be considered a plasma donor. So that's valuable. There may still be some concerns about if I test positive or if I test negative, is that completely confirmed that I don't have it or never did have it, or that I do have it? I think those are the parts about the accuracy of the testing that's still being investigated.
Okay. So Elizabeth just asked a question. I was just about to ask that, Elizabeth, before you typed in. We had a question once again about a vaccine. It just seems like these stay-in-place orders are so dependent upon a vaccine, but that might be a long way away. And I think that's why some of us have been saying, in what way could we partially reopen the economy so that we are keeping people safe. But do you want to address the vaccine question that Elizabeth wanted to know about, and again, many others have asked about?
Yeah, I think as it relates to a vaccine, there's still, it's going to be quite a period of time for the vaccine to be readily available. The organization CEPI, which stands for Coalition for Epidemic Preparedness Innovation, is a global alliance that's financing and coordinating the development of vaccines for emerging infections. And so this is a multinational coalition that is overseeing the vaccine development. And there are several trials actively underway for vaccine development. It is likely to be, as you've heard earlier, 12 to 18 months for a vaccine to be available more widely. So it would be difficult to continue to enforce a stay-at-home order until a vaccine is developed, because we would all be pretty sick of each other, I think. But I think in the meantime, another one of your constituents had asked the question about, in the meantime, until we have a vaccine, is what we're doing helpful? How long do we have to continue to do that? And I would say that based on the models that we have looked at in the past about the potential rate of rise of positive cases and a potentially overwhelming number of COVID patients in our community or in the state, we've definitely not seen it hit that very high capacity. And so for whatever reason, whether it's the behavior of the virus itself, or I'd like to think the influence of everything that the community members are doing about the stay-at-home order, washing your hands, covering your mouth, wearing the mask, wiping down surfaces, it is definitely contributing to the fact that we are not seeing those overwhelming volumes. We're not seeing our system's capacity overwhelmed, which is incredibly important to just being able to take care of those people who are seeking care, that we have enough of the resources and the protective equipment to manage that. Very, very important.
And, along those lines, so I have with me right now a couple of masks that Diane made up. I'm going to hold them up here. So she, just on her own initiative, decided to sew these masks. These are very, very nice, by the way. She gave me instructions on how to care for them. And so we talked about this a little bit in the last video, just the difference between an N95 mask and a face covering, because the governor mentioned in his press conference today a recommendation now to wear a face covering. And then it looks like starting May 1st, being out in a public area where there's a high likelihood of interacting with others, where social distancing is impossible, that the face covering is going to be part of the order. So can you just address that?
Yeah, I think that we're going to see the use of a face covering or cloth mask just be part of normal operations for a period of time. Just to go through again, that N95 is a very specific respirator mask that has characteristics or qualities that prevent the viral particle sizes from getting in through the mask. So that protects healthcare workers, very valuable for surgical procedures and procedures we call aerosolizing procedures. A surgical mask has some capability for protection as well. The cloth mask, which is really for non-healthcare workers, is meant to decrease the tendency for me, if I have my mask on, to generate respiratory droplets that could travel to you. And so it protects and reduces the risk of community-based spread, which will continue to be a risk for us as the stay-at-home order is eased up. We can expect to see potentially a little bit of a spike in the community spread again as people are out and about. The more that people continue to comply with using a cloth face covering, the less likely we are to have that impact, a significant spike in terms of positive patients coming in again.
And again, just the maintenance of these is fairly simple. You're able to just wash it in a regular laundry, right?
Yep. Soap and water, right.
Okay.
Regular laundry.
Let's talk real quick about just some of the PPE donations. I had someone ask if there's still a shortage. Are you still accepting, is the hospital still accepting donations of PPE? What about some of the things we've heard online about counterfeit PPE? What should people be looking for, or how can they protect themselves?
So first, I want to say thank you to the community. We have basically been able to provide through donated cloth masks, a mask for every healthcare worker in non-direct patient care. We've been able to provide cloth masks, which is just phenomenal, and some very creative things going on out there. We still are in critical shortage of things like isolation gowns. We're doing a little bit better with the masks now than previously, but there are still some critical areas of shortage. As it relates to potentially counterfeited or inadequate PPE, anything that is donated to NCH from the community or from local businesses, which we absolutely appreciate and really could not have managed through the current situation without all of this, goes through a testing process with our infection prevention team. So if we get a donation of N95 masks, for example, we make sure that we quality control it and identify that it is providing the appropriate protection for our staff and for our patients. For individuals in the community that have ordered, I think we might have mentioned this with one of your constituents before, have gotten masks or delivered or ordered them or something, how do you know they're safe? I would say probably, obviously, any cloth mask that you get, you should launder as soon as you get that. And then anything else, really, original packaging, sealed container, those are the types of things that I would watch for. And from a community perspective, really from a safety perspective, a cloth mask is what we're saying is adequate.
Okay. And by the way, speaking of other ways that people could help, so we talked about how you could donate items. I showed some pictures. I'll put them up here again. Mary Jo at the hospital sent me some great pictures of staff, and I think, yeah, that's one of the comfort dogs that we're showing right there. Some of your staff in the gowns. By the way, if you want to ask a question, please do so in the comments section. But I feel very passionate about donating blood. I did long before this, and so now there's just an even more critical need for maintaining our blood supplies. And so we finalized the details of that. I'm going to put this up on the screen. If you are a healthy donor, please consider giving blood. We are doing a by appointment only blood drive at the Palatine Township office. And let me grab the details of that.
And while you're pulling that up, Tom, great for you. I mean, that is so valuable in all circumstances. It is truly a gift of life to have people be willing to do blood donation. And during a time like this where people are hesitating to go to any kind of healthcare facility, it even becomes more critical that those that are willing, healthy donors, please participate in blood donation. It's really critical, and it's just such a welcome thing in so many circumstances that when me on the provider side has to order blood transfusion, that it's available from somebody like you on the donation side. So we really appreciate that.
Right. Well, I plan on rolling up my sleeve, assuming I feel healthy.
Yeah.
And again, we're taking extra precautions. I'm working with Vitalant on this. Anybody who donates has to make an appointment ahead of time. So obviously we're going to have a limited number of slots. You're going to have your temperature taken when you arrive at the Palatine Township Center. And again, it's going to be Saturday, May 9 to 2. You'll have your temperature taken ahead of time. So again, we're looking for fever. We're encouraging people to go through the donor questions online at home. That way it just expedites the donation process. For those of you who have given before, you're asked 50 or 60 questions. So we're encouraging people to do that online. And then also you're going to the staff is going to be wearing face coverings. Anybody who's donating is going to have to wear a face covering. The surfaces are going to be wiped down and disinfected to an even greater degree than usual. And so that's May 9th. So please consider doing that as a way of helping out. All right, we got, and again, some more people are jumping on here. If you have a question, please go ahead and submit that. Dr. Nelson, could you address the issue of mental health? So that might not be your area of expertise, but this is becoming a growing issue where people are isolated. They're social creatures. I think by design, most of us just really need that social interaction. And there are healthy things that people could do, but there are also unhealthy things that people might be driven to. And then you add on top of that the economic pressures that continue to mount. So could you just address mental health? Actually, the month of May is Mental Health Month, so I plan on interviewing a mental health professional on this. But since I have you on, what could you say about that?
Yeah, this is really such an important topic. I think that there's so many things that's sort of a perfect storm of this, is that social isolation, like you said, can be so challenging for people. Change of any kind is often really difficult for people to manage, and our whole world has changed. The idea of having to stay at home and reduce your interaction, it's a challenge. It's stressful for relationships that are otherwise strong, and stressful for relationships that have their challenges. In addition to concern and anxiety about the illness, there's stress related to jobs, businesses that have been closing, financial concerns for families, schools that are closing, parents that are challenged with homeschooling, and just all sorts of things that are just 3 months ago was not part of what's been happening. I think the most important thing that you can try to do is recognize that you can only control so much. There's things that are out of our control that we can't fix, but taking control of managing the stress as much as you can, trying to maintain social connections with others, whether that's on the phone, FaceTime, whatever it is, maybe watch a little less news, anything that can reduce your stress level. It comes back to just trying to make sure you're eating healthy, staying hydrated, getting enough rest, trying to get activity or being out and doing some walking, just really addressing things that will help both mind and body, and recognize both in yourself and others that this is creating stress that may add additional tension in relationships or in households, that we just have to recognize is part of the overall kind of challenge of dealing with the virus. It does not necessarily mean that the relationships or the household connections are deteriorating. It's just a challenge for everybody.
Yeah, thank you for those words. I've just noticed again a tendency. I mean, I love news. It's part of my position right now to know what's going on, but I also I found that just late at night I'm on my phone when I should be shutting it off. If you're not getting good sleep, it is going to impair your mental health. It's going to impair your immune system's ability to fight off whether it's COVID-19 or anything really. So no, that's a good advice for all of us. I'm going to put one more appeal out there. If you have questions, to please put them in the comments section. Someone wants to know if persons with sleep apnea are considered high risk. We know obviously asthma and other medical conditions would be. What about someone with sleep apnea who uses a CPAP machine?
So a person with sleep apnea is not necessarily considered at increased risk to get the infection, but a couple things that I would bring up is that if a patient does have a CPAP mask that they use, if that person develops COVID and they're at home, isolating at home, the use of the CPAP mask is considered an aerosolizing procedure, which could increase the risk of other people in that environment being exposed to COVID. So if you are a person with sleep apnea who also contracts COVID-19, you're definitely going to want to adhere to the social isolation and isolation within your household, because your use of your CPAP does increase the risk for others around you. However, you definitely want to continue to use your CPAP. If you do not use your CPAP, if you're a sleep apnea patient, you know that your oxygen levels can be lower. And COVID-19, part of the problems that it creates is it decreases the efficiency of our lungs, so our oxygen levels are lower. So that, compounded with someone who has sleep apnea that's not using their CPAP, can magnify the low oxygen levels. So yes, definitely use your CPAP if you are COVID-19. Sleep apnea doesn't necessarily increase your risk of getting the infection, and recognize that if you do have sleep apnea and are COVID-19, you have to adhere to social isolation at home.
And can you address, just how rapid, I talked a minute ago about all the information that I'm getting. I mean, how is it as a physician, you have researchers and so many people trying to work so hard on the vaccine aspect, figuring out, what the best path is to go forward. How is it as a physician to try to digest all this information? I mean, what are some of your sources during this crisis?
We're lucky to have a really excellent infection prevention team here at Northwest Community, both a medical director that has been exceptional throughout this and has really been a fantastic resource. We're also utilizing other organizations that have had a little bit experience a little bit ahead of us, like facilities out at the University of Washington, in San Francisco, out of New York. We have a lot of societies, physician societies, American College of Physicians, American College of Surgeons, and all of those are continuing to put out position statements and trying to gain additional resources to combine those. I also have been really impressed with the physician community, the fact that they have been very engaged in trying to stay, reading actively. This is a very challenging time to keep track of information that's very dynamic, continuously changing. And they have been doing a really fine job of reading, sharing information, talking to each other, comparing experiences and cases and other information and resources that they've had. So it's been challenging from a science perspective. It's very exciting. This is a very interesting work and a very interesting process. But from a clinician and a provider, the concern that we have for patients and keeping them safe is really top of mind, and we're working as hard as we can to figure out what's the best way to do this.
Mm-hmm. Do you mind, I don't know what your time is, do you mind taking a couple other questions?
No, I'm good.
You're good? Okay, all right. So
Yep.
Lee wants to know, how long are COVID-19 patients staying in the hospital?
Okay, good question. So when a patient is in the hospital for COVID-19, what we're seeing, so I'm going to kind of take a step back to give a little bit more information. When we talked about flattening the curve and the potential surge level volumes that we have been preparing for, what we're seeing is that the ICU level care requirements is really not increasing to surge level. We are seeing a slightly increased level of non-ICU level of care required, so more on our medical floors. When a COVID patient is admitted to the ICU, particularly if they need to be on a ventilator, those are longer stays in the hospital. We really are just providing support for the patient's lungs and treating them in a supportive way, waiting for their body to recover, and then we're providing whatever assistance we can. So those patients end up being in the hospital longer. For patients that go to the medical floor, this is non-intensive, not ICU level care, those medical lengths of stay are really typically have been less than a week. And really looking at ways, I think we're at about 5 or 6 days is the length of stay on the medical floor. So it's not a very long time. When patients then go home, we're recommending that they maintain then that social isolation at home for at least 14 days after they're home. And we're excited that we're going to be close to about our 100th discharge home on our COVID patients. We're at about 82 discharges as of today, so we're going to look for ways to celebrate. Hopefully we won't have any more patients that come in. That would be the best thing, but we look to celebrate that. Right.
Okay. And then did you want to address at all the concerns about a second spike of cases that is a possibility, like, later in the fall, for example, or next winter? Is that anything that you can address there?
Well, I think that we probably don't know enough yet to know about the seasonality of this virus or whether we can expect it on an annual basis. What we can expect, probably from a short-term and a longer-term perspective, is that as the stay-at-home order is eased and people are out more in the community, you can expect to see a little bit of a spike in community-based spread. And so we would expect to see that. Again, like we talked about before, the more you can do about all the precautions that you're taking, hand washing, face coverings, that can help mitigate that. Later in the fall, do we see a second wave or a future spike? We're preparing for that, just like we're saying, the PPE that we're creating in terms of storage and volume and capacity. we're going to keep that handy in case we need it. But right now, it's a little bit too early to know what we'll see.
Okay. All right. Well, I think that runs out all of our questions. Anything you want to say in closing? And again, I just so appreciate you taking time out to do this. These have been really, really well received. Again, people want to know what's going on in their local community. I mean, it's one thing to see hospitals in New York City or Los Angeles or Italy, but I mean, we don't live there. We live here in Palatine and Rolling Meadows and Arlington Heights and Inverness. And people want to know what is the situation at their current hospital. I mean, you and your staff, you live among us. You're part of the community, and if someone had a medical emergency, they would want to know that they could get care. We already talked earlier in the broadcast about people who had deferred medical treatments, and so they're concerned about that, and so it's just really, really helpful that you take the time to do this. But anything in closing?
I mean, I thank you for the opportunity. I think it's really great for the community to be aware of their, local situation. And we certainly are here to take care of patients, COVID or not. I mean, people are still having the everyday run-of-the-mill chest pain, and what we would encourage people is really don't avoid care. You should seek care if you have symptoms, anything that's different for you. Call ahead if you have a concern. But we're really here to serve the community and to take care of your needs. And I would say that in this situation, I miss seeing my patients. We've been doing a lot of telehealth visits with people, or telephone visits. I have been telling my patients that the one thing that I like better with the telephone visits than the in-person is that I can drink my coffee while I'm talking to them, but I would still prefer to see them. So we're looking forward to a time when we can kind of re-embrace the in-person visits. But until then, we have a lot of measures in place to be sure that we're keeping patients safe in the best way possible.
Right. Okay. Very good. All right. Well, with that, why don't we sign off? And again, thanks again for watching. We'll post this later. Please share it. And our best to you and your staff. And thanks again for joining us. Have a wonderful day. Okay.
Thank you.
If you like videos like that one, make sure to hit the subscribe button and like and follow our pages so you'll stay up to date. Thanks again for watching.